Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Good afternoon, and welcome to another episode of the Dental Brief. Today we have with us Dr. Dave Shirazi. Say hello, Dr. Shirazi.
Hey, how you doing?
I'm great, and I'm thankful as always when we have dentists on the episode. It's so great to have doctors on here to share their experiences and to help other doctors. We really appreciate that. So why don't you tell me a little bit about your background? Let's talk about, and I know you're a TMJ expert, but we're going to first start about how'd you become a dentist? What first got you interested in dentistry?
Well, my mom's a dentist. Everyone in my family is a doctor or a dentist of some kind. My father was a pharmacist. And when I was 14, I was watching my mom do a root canal, and I thought it was the coolest thing. So I love working with my hands. I love talking to people. And I thought, well, this is fun for me. And I didn't like the concept of medicine as it is here in the United States because your patients die on you.
Sure.
And that wasn't something I was really looking forward to being a part of. After that, I worked as a dental assistant, first for her, then for other dentists, right up until dental school.
Wow. So I'm assuming you went into general practice at some point. Is that right?
Yeah. So right out of school, at first, when I went into dental school, I wanted to be an oral surgeon. Okay. The last 4 years before dental school, I was assisting for a periodontist, and I loved it. And I entered dental school with my own scalpel with a number 15. And I was lucky enough to have 5 girls on my cadaver on my first semester. And
Sure.
They were fine with me doing most of the dissection. It was perfect for me. And I loved it. It was, I love surgery. But they were, the teachers were showing, I was telling them about being a surgeon. And they were showing me these lateral sets of these people that had post-TMJ surgery and with all these bolts in them, right? And I would tell these guys, I'm like, how does the patient function like that? And they would say, we don't know, right? And I said, well, why are they doing it, right? And he goes, well, this is in 1996, right? They're like, well, it's a very much like a cowboy, let's just, because they don't have any other options. Let's
Sure.
just throw this at them and cross our fingers. Right. And I was so naive back then. I thought that if you're a specialist, you can't turn it down. Like I used to joke that if you're a root canal specialist, you can't say, well, that root canal is too hard. I can't do it. Right. But they do that all the time. But their verbiage is, this tooth is unsavable. Just pull it.
Right.
Right.
Yeah.
So I naively got, so as soon as I got out of dental school, I was doing about almost 200 hours a year of CE in everything. But my preference was orthodontics. My mom was really pushing me to do ortho, and I'm very grateful that she did. And I met up with a great group of docs. We worked on some really interesting cases, and I really loved this aspect of it, which then helped me to then just move on to things like TMJ disorders and sleep apnea.
Yeah. So I know you specialize in that now. Do you still do general dentistry as well, or is your practice mostly made up of sleep?
Mm-hmm. Yeah.
Makes sense to me.
I have 2 practices, and I'm basically pain, sleep, and ortho.
Fantastic. So some awesome, I know we're going to have some awesome answers to some of these questions. So You're getting referred patients from doctors, all over your area in California and probably even the country. What are some problems that you see? What are some struggles and problems that you see that dentists are facing that you can help with?
Well, the most common problem affecting dentists that they know of is patients who are bruxing and they make them a night guard, right? And they find that some patients, they make them a night guard and they're like, patients like, yeah, I'm less sore with the night guard, right? And others are saying it's worse with the night guard, right? And so one of the things I instruct patients, dentists to tell their patients is, okay, so I don't know if you have a minor jaw problem from your clenching or a major jaw problem. So one of the ways that we can test is I can give you a night guard, and if that helps you, great, right? If it doesn't help or it makes it worse, then we know that you have a really serious jaw problem and you should go to an expert, right? And that kind of covers their butt. You know what I mean? Because the patient, if the patient wants, if they intuitively know that they have a bigger jaw problem than a night guard can solve, then they'll tell the dentist, you know what? No, forget the night guard. Let's go straight to the expert. But most patients are like, well, let's do as cheap a option as possible. Let's try that night guard. If it works, fingers crossed, right? So that's like the biggest thing. But the other things that are more subtle that dentists don't know can be related. When dentists have patients that they're doing the inferior nerve block to get them numb to work on their lower teeth, these patients that are very hard to get numb, these are patients often with a very chronic, centrally sensitized disorder. Could be related to their jaw, could not be, but these are usually patients that need a pain expert, right?
Sure.
If they can't open very wide, I've seen dentists say, yeah, those patients that I can't open very wide, I'll just send them to the endodontist for the root canals because I don't want to hurt my back or neck or whatever. It's like, no, why don't you take the fact that they can't open very wide is the main problem, right? I used to have an ad that I ran in the Santa Barbara Ventura County Dental Association, and it was a Panorex. And the reason I chose a Panorex is because as a dentist, if we see a dental X-ray or a Panorex, we go into diagnosis mode, right? We just hone in. No one asked us for our opinion,
right.
But we hone in on it, right?
Sure.
But I had a lovely Panorex that showed arthritis in the capsule. The second molars had crowns and root canals and etc. That was crowding. And I just used it as an educational tool. And I said, you see how it's just the back teeth with crowns and root canals and etc.? Well, when we clench, those are the first teeth to get beat up, right? Sure. And if there's arthritis on a Panorex, which only really shows the lateral poles of a condyle, then, well, they've probably been bruxing a lot more, and it's probably worse on the center and the medial pole. So these are opportunities to refer to get yourself, out of trouble. Doing dentistry, like the jaw is the foundation of the bite, right? So if you know the patient has pain, clicking, locking, limited range of motion, and they need something done, and you do it, and usually we see the problem happens from the dentist having the patient's jaw open too long. That becomes a problem. But also it can happen is if their jaw problem gets worse, or if they unlock, their bite might be off because of that new crown you had put on.
Sure.
Right? Because you changed the jaw, you changed the bite, but now the bite's different because you just put in a crown. Right? And the patient, will blame the dentist typically.
Yeah. So here's the tough question, and I need to find a kind of a politically correct way.
You don't have to be politically correct with me.
I do for our audience, right? I did not for you, for our audience. I know a lot of dentists. We get the call all the time, what I do day to day, and it's like, hey, I want to start doing TMJ. I just started doing TMJ, or I just started doing it, and I'm adding this to this practice. And oftentimes, it's for revenue, right? So really what has the dentist interested is they're trying to figure out a way to offset how the insurance companies are hammering them or how they feel like they're being hammered by the insurance, and they're trying to find other things to do to bring in. So let's say a dentist has been doing TMJ for a couple years and has worked with had some success on a few patients here and there. What's a telltale sign that they need to refer to someone who's only doing TMJ, who's just an expert in it? That's all they're doing day to day. How do you decide, or how do they decide, hey, this one is, like you said that endo says, hey, it's just too hard. It's outside of my league. How do they do that?
Right. So the easiest way was the first thing I said is when you tell the patient, hey, I'm going to make you a night guard. If this works, great. If it doesn't, then, you have a severe problem. I'm going to just to let you know that you're letting the patient know in advance that, listen, if you have a severe problem, it's not my fault. Okay.
Right.
It's
Sure.
because you have a severe problem. Night guards are standard of care for someone who clenches and bruxes their teeth. If it helps, great. If it doesn't, then hey, go see a specialist, right? That's
Sure.
like the first way. I do find it very hard for dentists to know which case is too hard for them, and even which case to treat. So, you said that you had Dr. Steve Olmos on your podcast before.
That's right. Yep.
So he teaches a methodology of neurological evaluation to find out if the person has what's called a TMJ primary problem or a secondary to something else, right?
Sure.
Now, that's the thing. If the patient has a secondary problem and you go and make them a day guard to fix their jaw problem, that's going to be a disaster. That's not going to work. Okay. But you need to know, you need to be a diagnostician and find out what is going on with the person. Okay. We know that 50% of the time, the reason why we clench our teeth is because of a version of sleep apnea called upper airway resistance syndrome. Yeah. So you need to kind of disclose this to patients and go, listen, yeah, let's say we even fix your TMJ problem. I don't want to mask a more serious sleep apnea problem. I recommend you go to a doctor and go get that sorted out. You need to document that.
Right.
You need to document that. Documentation is one of the most critical things that dentists need to know. What state are you in?
I'm in Colorado.
You're in Colorado.
Yep.
So California, especially the dental board, has become extremely litigious. And they will ding a dentist for anything, right? So if the dentist, the records were incomplete or it doesn't matter how trivial. It doesn't matter that you didn't harm the patient.
Right.
They'll try to ding for anything. So
Right.
The first thing is records. Make sure everything is documented.
Sure.
Yeah.
So, David, a lot of Dr. Shirazi, a lot of people that are listening to our show are definitely trying to better their practices. Big part of our audience, they're trying to grow. They're trying to do better today than they did yesterday, which is fantastic. That's why I love doing this. Let me ask you this last question. Let's say a dentist is considering getting into TMJ, and they have some money motivated behind it. They're thinking, hey, I need to
go take a course. Go course.
Yeah, what are some telltale signs that this might be right? When you have to, when you meet doctors that are really good at this, right?
Mm-hmm.
That really love and are really good. What are some attributes that they have, some characteristics that you see in them that are different?
So the temperament is the most important thing when dealing with pain patients. Sleep patients are a lot easier with respect to how happy they are and they're just really tired and they're struggling and you're there to help them, and the results you get from treating sleep apnea happen usually a lot faster than they do for a TMD patient. And sometimes TMD patients don't like to be in the waiting room with their OSA patients that are in the waiting room, because the OSA patients are like, good morning, how you doing? Just came to see Dr. Shirazi, right? And they're like, why is she so cheery? Right? They can't talk about it, right? So I think you made a good point. If a dentist has done a few cases under their belt and they have the patience, the empathy, the compassion to deal with someone with chronic pain, then taking courses, and really the main course I recommend people take is by Dr. Olmos. It's the most comprehensive course I've ever seen in my life. Yeah. Then they would be, a good candidate to, help their population. But if they've done a few cases and they're like, well, that patient was crazy, right? I mean, just run away. You're gonna run into that a lot, and if you can't deal with it, you're not gonna be happy.
Yep, makes sense to me. Speaking of being happy, let's try to make you happy here a little bit. I'm gonna definitely recommend a dentist in the California area that have patients that need some help in this area. I'm sure you're accepting referrals. The website is TMJ and sleeptherapycenter.com. Feel free to reach out to Dr. Shirazi. And then, of course, dentists across the country, if you got questions he can help you out with. I I recommend you blowing up his phone.
And I'll tell you, thank you so much for that. But I'll tell you an easy website to remember, because I have two offices, one in LA, one in Thousand Oaks. Yep. So tmjla.com is one, and tmjconejo, conejo.com are the two websites where people can, refer patients or find out more for themselves. I have some videos on YouTube. I did a Google Talk. There's many different ways to learn and to refer.
It's fantastic. Sir, Dr. Shirazi, thank you so much for coming on today. We appreciate you.
It's my pleasure. Thank you for having me.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.